Here we go, here we go. Well, what's going on, Charlotte County? Hope all is well. My name is Kris Chana, the owner of Chelsea Senior Care and the host of Senior Source TV. And today I got a special guest with me, Mr. Breck Rubin from Medicare Care Tenders. What's the official word?
Yeah, Medicare Care Tenders Home Health Care.
Medicare Care Tenders Home Health Care, and they are a Medicare home health company.
Right.
And today what we want to do is come to you with three things. We're gonna talk through three things that are important about Medicare home health, and you know, one of those being like, you know, what is it, and then who pays for it, and the last thing we'll cover is how do you get started in it. So you know, that being said, I mean, so Brett, well, first of all, how long have you been, you know, working for Medicare? How long have you been working in the industry or in home health?
Been working with Medicare for 6 years, Chris, and been working in the industry for about the same.
Okay.
I've actually been working 10 years in Charlotte County with the medical community altogether. Did some imaging, worked with an imaging company, but primarily with Medicare Home Health Care for 6 years.
Gotcha. Awesome. And so you've been, wow, so 6 years with Medicare. You know, for people that don't know, I did a video not too long ago, and we talked about like the 6 differences between private home care,
right,
and then, you know, Medicare home health. But maybe you could kind of elaborate a little bit more on what services, you know, you guys provide, specifically to Medicare, but also like, you know, just as, you know, the industry as a whole. Like what does Medicare home health include? What services do you guys provide?
Good question. We are a certified Medicare company, and what we provide is skilled nursing, Chris.
Okay.
So a nurse would go out, it has to require a skill. That's the specific requirement of a Medicare certified company.
And what is, and because you know, sometimes, you know, for us folks that are like not in the medical field, like what does that mean? Like what does a skill mean?
A skill would be, let's say for instance, you have a senior in their home that needs has a lot of medication. It's all over the place. They don't have it organized. So actually it would be a certified registered nurse that would go in, put everything in order, organize it, teach them how to use it. It's a great skill that is required. They require a registered nurse to go in and do that.
Gotcha. So it could be I mean, I guess I'm saying, who really assesses like what that skill is? I mean, is that something like would I be able to do a self-assessment of that, or do I need someone to make that assessment for me? Like, how do I know if I need that?
Yeah, good question. That's what we do is we go in and it's an evaluation. We send in a registered nurse. They evaluate the patient, make sure that there is a skill that they are qualified for and that Medicare will cover. Gotcha. And then we're able to go in there and help that patient specifically with what they need.
Okay, and so guys, give me kind of like a general idea of like what types of services. So now we've identified that there's a skill needed. Right. What types of services then would I be able to, you know, help someone with?
Well, with the skilled nursing, there's all kind of things. The nice thing, Chris, is it's an extension. If you go to your doctor's office, you have a nurse there. It's a nurse basically that's going to go in the house and be an extension of the doctor's office, which is nice. Yeah. Medication management, check vitals, blood pressure. They're going to be able to you know, monitor disease-specific things that they might be involved with, education, teaching. Pulsometer, see what the O2 is in the patient, what they got, and so just anything that a registered nurse would do specifically. That's what we would do in that.
What about like I know sometimes, like, you know, in the assisted living facilities, you know, side of things, you know, we use you know, like someone might have had a decline, or maybe they went to you know, a hospital, you know, now going through a rehab facility, now coming back home to us, and you know, they still need a little bit, like, kind of like to bridge that gap, because like they're still not walking like they were before. They're still kind of going through this transition period of healing, you know, whether it's a hip or maybe a knee or some sort of surgery maybe involved there. So like, I guess, you know, in that case, I'm assuming we're talking more like physical occupational therapy. And I guess what's the difference between, you know, physical therapy and occupational therapy?
Yeah, good question. I think the one thing I just wanted to mention to everybody is that one of the key things with home health care, Medicare certified, is we're a preventative measure.
Okay.
So that's something we're really focused on right now, Chris. So in regards to, we have like a fall prevention PT program. Okay. So the PT will go in and help with like abnormal gait or balance issues. Okay. Help them with their balance, strengthening. An occupational therapist will teach like energy conservation techniques. Yeah. We work with a lot of patients that are going through cancer
Right.
or that are struggling with energy, teach them techniques in the home that they can minimize their energy use.
Right.
OT is going to teach a daily living, dressing, you know, getting them to get back into the practice of being able just to be able to eat the right way.
Right.
And you know, daily living things that they've forgotten or they've gotten out of the habit of doing. The occupational therapist would help them with that.
Gotcha. Okay, and then so this got, you know, the kind of the difference between the OT and the PT. You know, I mean, the gait versus some of the home, you know, the kind of like the stuff that might be more important to their like home life versus the stuff that's maybe more important to like their physical well-being.
Exactly.
You know? So and then I know sometimes with like skilled nursing they talk maybe like, you know, like some of those other things you're talking about with certain diseases or certain diagnoses that are maybe ongoing or chronic or maintenance or managing that or helping someone maybe even, you know, if they're new to oxygen or something like that, right?
Yeah, it's a lot. It's a lot. Our goal is to instruct them and teach them, and
Right.
we're not in there for long-term, Chris, but we want to educate them
Gotcha.
or a caregiver
Gotcha.
to be able to go forward and do this on their own. So
Gotcha.
our goal is to empower the patient to be able to do these things themselves.
Gotcha. So essentially, so it's really getting in there, helping someone out with a skilled activity or a physical or occupational therapy temporarily.
Yes.
And then you know, once that person's like shown that, okay, hey, you know, or we've shown their caregiver, we've shown the family or that person, you know, to be able to do it on their own. Now it's like, okay, you know, we've done our job, we've done our part as a company,
Right.
is to help show them, to teach, to help maybe
Right.
gain some strength and some you know, some advancement in certain areas. But then at that point in time, then you know, they're left to be able to take care of those things on their
Yes.
own. Okay.
Yes. A couple of things too that we do a lot of wound care.
Okay.
We do a lot of wound care, nutritional counseling
Okay.
as well. Somebody has diabetes.
Right.
Help them with specific foods, education, blood sugar,
Okay.
and those type of things. So, like I said, I'll always go back to typically whatever the nurse is going to be able to do in the doctor's office, we're going to be able to be extension of them in the home.
Gotcha. So help facilitating some of those things.
Exactly.
Yeah. And then for a temporary period of time, so that way at some point in time they can do that on their own.
Right. It's a typical 60-day episode with Medicare.
Okay.
And so if they need it longer based on the physician's requirement or plan of care, we can extend that.
Okay,
So it's a 60-day episode. Sometimes they're there 5 days.
Now, do
5
they
visits.
automatically get 60 days, or does it depend on
Automatic.
Like, okay, so
Everybody
it's
gets
at least
that.
that.
Yes.
And then if they need more than that, it would just depend on the physician and Medicare and the insurance company and
Yes.
stuff. Okay.
Yes.
So speaking of that, because that kind of transitions into like our next question, which was how you know, who pays for this? You know, is it out of pocket? You know, is it Medicare? Is there private insurance? How does that work?
Great question. Medicare, it's a beautiful, beautiful part of Medicare. They cover home health care, Chris, 100%.
Okay.
So even if a senior does not have a secondary,
Right.
with home health care, they don't need it.
Okay.
So Medicare will cover it 100%. It's actually against the law for somebody to receive a bill if they have Medicare and they're getting home health care. Covered
Gotcha.
100%.
Gotcha. Okay. Wow.
Great
So-
benefit, Chris, actually, that
yeah.
most people that have Medicare are not aware of.
Right.
So-
So then if you know, I guess, is there any, like, if they have Medicare, is there any out-of-pocket expense for them at all?
Nothing at all.
Okay.
No,
All right.
nothing at all.
And then what about like someone that maybe has a Medicare Advantage plan or a Medicare replacement plan?
Sure. It's going to be dependent, Chris, a lot of times on the company. We do, Mederi specifically takes other insurances like an Aetna or United Healthcare, VA insurance, TRICARE. That's something though that we run through a corporate office authorization. We check every plan is specific based on their home health care, what they're
Gotcha.
going to cover. So the managed cares is a little bit more tricky to speak on because it's based on their individual policy,
Gotcha.
but they do cover home health care.
Gotcha. So if you had a plan that was not Medicare, essentially what would happen, the best thing to do would be to like, you know, speak with, you know, someone like you.
Sure.
To find out, so that way you can go and say, hey, look, I can at least go and figure out what we can do for you.
Right.
Right.
Right. And if it comes back, Chris, that let's say that 50% with us, only 50% of the plan is covered, we want to go ahead and point them to another agency that will cover that insurance 100%. Because
Gotcha.
we don't want the patient to be able to pay anything out of pocket.
Right. So it just really depends on, really depends on, you know, that plan. You know, if it's a Medicare Advantage or Medicare replacement,
Yeah.
it's definitely going to depend on what that plan,
Yes.
you know, what it says. But if it's if it's straight Medicare, that's pretty, you know, straightforward, you know, as far as what it covers and how that works.
100%,
Okay.
100%.
Yeah.
And that can be over time, Chris. We've had patients on service with us for years.
Gotcha.
As long as the need is there and as long as the doctor signs an order and has a plan of care specifically for that patient, we can continue to help them if that's a need.
Okay, and then so you know, really perfect transition to this third question,
Sure.
which is, you know, yeah, how does someone get started with Medicare Home Health? Like, how does that process, you know, begin? What do I do as a patient, or if I'm caring for a loved one? You know, what do I do in that case?
First thing is to have a conversation with your doctor.
Okay.
And a lot of times our job on the marketing side is to educate the doctors on what we provide.
Gotcha.
So it is connecting with your doctor, sitting down and having what we call a face-to-face with them, assessment. And then what happens is the doctor will actually write an order specifically for what the patient needs. They will send it to the company they want to use, and then what will happen, we'll take it from there, Chris. We'll call the patient, we'll schedule, we'll send out a nurse to open the case, usually about hour and 45 minutes to 2-hour initial assessment from head to toe, and find out what it is. If we see that there's some other needs, we're going to go back to the doctor and say, hey, Dr. Jones, we see that this patient could use physical therapy.
Gotcha.
What he would do would add an order to
Gotcha.
that.
So essentially the doctor's office and then you guys are kind of tag teaming, you know, the client's needs. You know? I'm saying the doctor might recognize something in the office, you send a nurse out to the house and kind of verify that that's the need,
Right.
or even maybe discover if there's one that's more important, you know, because of their home situation.
Exactly. One of the things too that I think is so important, Chris, is that we want to work closely with the doctors to help keep patients out of the hospitals.
Gotcha.
That's a big
So
thing.
that's
for
part
us.
of the preventative thing.
Yes,
Right.
preventative
Okay.
measure. So, and that just comes with education of the doctor. I'll give you, for instance, Chris, and maybe this will help somebody that's out there. A lot of times, people will come into a doctor's office weak and wobbly using a cane or a walker.
Right.
And I always want to let the doctor know, be looking for that type of a patient because there is a fall risk there.
Right.
One of the things, Chris, as you know, being in the senior care world, that so many seniors are falling, and a lot of times you know, they break a hip, or you know, it shortens their life, unfortunately. So fall prevention for us and educating the doctors and also the people that are tuned in and is a real important thing. So we want to get this ahead of time before there's a fall.
Gotcha. Okay.
So
if someone was listening right now and they're caring for, you know, their loved one, they're caring for their mom, their dad, a spouse, and they're like, hey, you know, I can see how my mom or dad could use some of these services.
Right.
You know, what do I do now? What would be your advice to them?
I would just let you know to connect with your doctor. Let them know you're concerned about mom or dad, that you're seeing a couple things or something doesn't seem right. Schedule an appointment. Let them know what your intention is, and you know, they'll take it from there, and you know, connect with us or whoever they choose to use in regards to providing those services. Also, Chris, you know, we're available to answer questions anytime as well. You know, we're a local agency and happy to help any way we can with.
And if someone you know had questions specifically, you know, for you guys, like, what would be the best way for them to contact you?
Yeah, just is it okay just to give out a number, Chris? It'd be 941-764-7555. Be happy to answer any questions that you might have with home health, Medicare certified home health care.
Okay, awesome. Because I mean, the thing is, a lot of times people don't know the difference between, you know, private home care and what you guys do, and they might, you know, you might come into the home, might be caring for somebody, and then the family's like, well, hey, can you do this and that, and it's like, well, no, that's not what we do, or actually we only have one more week with you guys, and then that's where kind of like that, you know, so it's like understanding the difference between those two, because they're so similar as far as like the way they're you know, the worded, you know, home health, the way the state you know, has licensed them, they fall under the same license, you know, license category. So, you know, I think it's important for families to know the difference between the two of them, you know.
Do we have a couple minutes just to touch on a couple of those things, Chris? One of the big things that I just wanted everybody to know is that we, as a Medicare certified agency, we're going to go out 2 to 3 times a week The initial is about 2 hours, but after that it's going to be about 40-45 minutes with a nurse, a PT, OT, speech therapist, and that is what Medicare allows.
Okay.
So if you have a loved one that needs longer care,
Gotcha.
needs somebody to be with them a longer amount of time, needs to take them to the store, needs to make meals for them, maybe light house cleaning, those type of things, transportation, that would be a private duty company, Chris,
Right.
that would do that.
Right.
So yeah, it's just important to know that we'll be able to be out there to specifically address that skill about 2 to 3 times a week. There are instances if you have wound care, we can come out daily. That would be a daily. It's going to be dependent on what you have as an individual and what your doctor's recommending and what the plan of care says. But we do have cases where we're out there daily doing wound care, 40 minutes or so. But that's one of the big differentiators is the time allowed in the home.
Gotcha.
So that's a good place. That'll help somebody make a decision. My loved one needs round-the-clock care.
Right.
Definitely a private duty company would be able to help them with that.
Round-the-clock care or ongoing safety concern throughout the day or
Sure.
something like that. So that's when private home care versus Medicare Home Health is kind of the
Exactly.
differentiator, So this is more specific.
Yeah.
It's limited periods of time, maybe a couple times per week. It's dictated by the insurance company, and it's not necessarily it's based on that person's need functionally or skilled wise, but not their ongoing safety measures and stuff like
Exactly.
that. So.
Yeah.
Well, cool. Well, if you guys have any questions, of course, reach out to Breck, with Mediri, and if we can be of any help or at least provide a referral, in your area, please let us know. We're happy to help, and I hope this was helpful for you guys. If you haven't already, this might be live on Facebook right now, but for those that are on our YouTube channel, make sure you subscribe to our page. If you're on our Facebook, make sure you like it. Our goal is to just provide you with as much educational information as we can, and make sure that you are, educated, informed, and empowered to make the right decision for you and your loved one. So thank you so much for your time today. Breck, thank you, man, for joining us on the show and educating folks on what it is that you guys do and how it works. So.
Absolutely. Thank you, Chris, so much.
Appreciate it, man. We'll see you all soon. See you guys.